Miss Estrada?
Yes.
Hi, student Dr. Villasecca. Nice to meet you.
Nice to meet you too.
How are you doing today?
I'm doing well.
Pretty good. Okay, and what brings you in?
So I was playing soccer with my friends the other day, and as I was running, I kind of stepped down on my foot in a wrong way, and I think I twisted my ankle.
I think you twisted your ankle.
Yeah.
Okay. So you're playing soccer, you said?
Yeah.
Can you point to me exactly where the pain is?
Like right around here.
Okay. And is the pain constant throughout the day? Does it come and go?
It comes and goes.
Comes and goes?
Yeah.
Okay. And if you had to describe the pain as sharp or dull, how would you describe it?
When it comes, it's pretty sharp.
Pretty sharp. Okay. And is there anything that makes it worse?
If I'm standing on it for too long, it starts to hurt.
Okay, standing on it, putting
Yeah.
too much pressure on it, something like that. Okay, how about anything that makes it better?
I usually have to kind of elevate my leg a little, and then if I put some ice, it starts to
Ice
feel
and
better.
elevation? Good,
Yeah.
good, good. Those are all good things. Now, does the pain radiate up your leg at all, down your foot, or is it pretty central on the ankle?
It's pretty central.
Okay. And how many days ago did you say this happened?
About 3 days ago?
3 days ago? Okay. And if you had to rate the pain on a scale of 1 to 10, how would you rate it?
I would say about a 7.
A 7. Oof. Okay. All right, so we're going to check it out. I'm going to ask you a few more questions just so we can better assess you. Have you had any surgeries or hospitalizations recently?
No, I have not.
No? Okay. How about any serious illnesses as a child or as an adult?
No.
No? Okay, good. Are you on any medications?
No, I'm not.
Okay. Are you allergic to anything? Food, medication, anything like that?
Not that I'm aware of.
Okay. And have you had any transfusions recently?
No.
Okay, good. The patient is alert and aware of what's going on. All right, I'm going to ask you a few more questions. These are going to get a little bit more personal, but bear with me and answer as honestly as you possibly can.
Mm-hmm.
Do you smoke?
No, I don't.
Okay, good. How many hours of sleep would you say you get a night?
I'd say I get about 6 to 7 hours of sleep.
6 to 7 are good. And I have to ask, are you sexually active?
Yes, I am.
Okay, are you in a monogamous relationship?
Yes.
Okay, and do you practice safe sex?
Yes.
All good things. Do you do anything for work?
No, I'm currently a student.
Okay, good. Congratulations. As far as exercise, how often do you get to do that, if at all?
I try to exercise at least 3 times a week.
Okay, that's good. Pretty active lifestyle. Do you drink?
I drink socially.
Socially, and how often would you say socially?
Like 1 to 2, maybe times a month.
2 times a month, okay. And your diet, how would you describe your diet?
I try to maintain a pretty well-balanced diet.
Okay, good, pretty healthy.
Yeah.
And do you use any illicit drugs?
No.
Do you have any pets?
No, I don't.
Are you married?
No.
And have you traveled anywhere domestic or international in the last couple weeks?
No, I haven't.
Okay, good. Thank you so much. All right, so the next thing we're going to do, we're going to start with our physical examination. So the first thing I'm going to do is your dermatological examination. So what I'm going to do is I'm going to check the anterior side of your skin here. Looks good. Dorsum of the foot looks good. Let's check the plantar side of the foot. Good. Posterior aspect of the foot here. Of the leg, excuse me. It looks good. No abnormalities that I can see here. Great. Okay, I'm going to check for any maceration or fungus between your toes here. Nope, nothing here. And nothing here. Looks very good. Your nails look nice and healthy as well. So that's great. Next thing I'm going to do is your vascular exam. So first thing I'm going to do is check your pulses. So dorsalis pedis, strong dorsalis pedis pulse. I'm going to rate it a 2 out of 4. Check your posterior tibial pulses here. Both strong. I'm going to call it a 2 out of 4. Let me see if I can get your popliteal flexion here for me. If that ever hurts your knee or your ankle for that matter, let me know. Okay, strong popliteal pulse. I'm going to call it a 2 out of 4. Check this one right here. Okay, 2 out of 4. Okay, next thing I'm going to check is your skin turgor or your elasticity. Looks good. Check your capillary refill time here and your digits. Very good. All 10 digits refill within the normal 3 seconds. Hair growth looks normal. Temperature goes goes from warm to warm, and there's no sense of edema, so that's good. Good. So the next thing I'm going to do is the musculoskeletal exam. So the first thing I'm going to need you to do is to push down on my feet as hard as you can. Very good. Can you pull up on my hands? Very good. Push out on my hands. Very good. And how about in? Very good. Okay. Now I'm going to check the range of motion of the foot and ankle. So on this foot, let me see here. First I'm going to check your first ray range of motion, okay? First ray looks good. Side. First ray looks good. Please let me know if your ankle's ever affected here. Okay, next thing I'm going to check is your mid-tarsal joint range of motion. Mid-tarsal looks good. Very good. Okay, subtalar joint. So I'm going to check here, excuse me. Subtalar joint range of motion seems good. I'm going to put it in neutral. I'm going to dorsiflex your foot here. And very good. Very good amount of dorsiflexion, no signs of equinus. And then we'll do the same thing here on the left side. So subtalar joint range of motion. There's a little bit, okay. That's normal, considering you sprained it. But there's a little bit of swelling, but bear with me here. I'm going to put your subtalar joint neutral. I'm going to dorsiflex. Let me know if it hurts. Just a little bit. Okay. Still pretty good considering, but it is a little bit limited probably due to the swelling. The next thing I want to do here is I'm going to ask you to flex your knee here a little bit. And dorsiflex your ankle. Good. Get a little bit more dorsiflexion on this side with the knee flex. Again, a little bit limited, just probably due to the swelling. And we'll just do this foot here. Very good. I would say definitely more than 10 degrees of dorsiflexion there. Alright, so the last thing we're going to do is the neurological exam. So the first thing we're going to do is something called the 10-point test. So what I'm going to do is I'm going to use this monofilament so you see what it feels like. I'm going to touch 10 parts on each foot, or 10 places on each foot. I want you to just say yes if you feel that on your foot, okay? Okay. Okay, close your eyes for me. Alright, so just say yes, nice and loud, okay?
Yes.
Good.
Yes. 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 Yes.
Very good. Left foot here.
Yes. 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 Yes.
Okay.
Yes.
Good, very good. You're not ticklish, that's a good thing. Alright, the next thing I want to do is the proprioception test. So what I'm going to do is I'm going to grab one of your digits, okay? I want you to tell me which digit I'm grabbing and if I'm pushing it up or down, okay? So big toe is number 1, pinky toe is number 5 for each foot, okay? Alright, so close your eyes for me. Okay, close your eyes for me. Ready?
1 down.
1 down, good.
5 up.
Good.
3 up.
Good.
1 down.
Good, very good. Okay, the next thing I want to do is the sharp and dull test. So I have these 2 little tools here. So I'm going to show you what sharp feels like. It's going to be something like this. And dull is going to be something like this. Okay. Okay, so I just want you to tell me if you feel sharp or dull. Close your eyes for me. And...
Sharp.
Good.
Dull.
Good.
Sharp.
Good.
Sharp.
Good.
Dull.
Good. Thank you. The next thing I want to check is your vibratory senses. So I'm going to hit this. I'm going to put it on one of your bones. I want you to tell me if you feel the vibration. And also I want you to tell me when it stops, okay? Close your eyes for me, please.
It started.
You feel it?
Stop.
Good.
I feel it. It stopped.
Good.
I feel it. And it stopped.
Good.
I feel it. And it stopped.
Awesome. Okay, I'm going to do the Babinski test here. So just bear with me. Good. Very good. Thank you so much. Now, the last thing I would like to check is your reflexes. So you can scoot forward for me. Good, thank you. The first thing I'm going to check is your patellar reflex. So, relax. Good. Good. I'm going to check your Achilles reflex now, okay? So I want you to just relax. Good. Good, very good. Okay, you can scoot back from me if you want, or it makes you more comfortable. All right, Miss Estrada. So, I do believe that you did sprain this ankle, okay, based on the test and the way it looks. That being said, I also want to send you out for x-rays, just plain film x-rays to make sure there's no fractures. Also, I'm going to order an MRI for you to make sure it's nothing tendon related, just so we can eliminate all those possibilities. For now, though, we are going to immobilize the ankle. Probably put you in a cam boot to get out of here. And then I'll send you out for physical therapy. As far as medications go, I'm going to prescribe you some ibuprofen, probably 800 milligrams. You can take that 3 times a day as needed for pain and inflammation. And then I can show you some strapping techniques to help you, to make it feel better, make it more secure. And then we will see you in 2 weeks to make sure it's healing all right. Does that sound good?
Sounds good. Thank you.
All right. Thank you so much. Okay. You have a nice day.
You too.